We'll call the meeting to order now at 1:04 a.m. Mountain Time. Brandy, do you want to do roll call?
I said, yep, I think I'm muted. So we have Dr. Brown. We have Brandon Smith from KAI, Christina from KAI, Tiffany Shangru, Amanda Marr from LeadingAge, Travis, Jared, Janine from LeadingAge, and Melissa. And myself, Brandy Hodges.
Okay, thank you. Did everybody get to look at the minutes from the last meeting, 12/21/23?
Yes.
Yeah, I guess there's not a whole lot on there. Does any questions or changes?
No, I recommend that we approve the minutes.
Okay. All in favor?
Wait, I don't think we have a second yet, do we?
Oh, sorry. Sorry, I jumped the gun.
That's right.
I'll second it.
Okay, all in favors?
Aye.
Okay, motion passed to approve the minutes. Next is the treasurer's report by Jared.
Okay. So the treasurer's report goes through February, and in January and February, there's been no listed expenses and there's been no revenue. So it just has a zero balance. I think it was toward the end of February when invoices went out. And so I know that there has been some revenue generated, but it was in this month. And so that's the reason why nothing's reflected on the profit and loss statement. There is typically expense associated for each month, whether it's some type of software agreement fee or something. There's always something. About $100 is what it tends to run, but there's nothing listed on there yet either. So I'm expecting in March that the financials will look a little different, but as is, we have a zero balance for this year so far. The balance sheet shows that from the previous years, we have $15,915.23 in the account. And so that's all I have to offer for a financial report.
If anybody if there's no questions, the KAI report's next.
I think we have to approve the treasurer's report.
I'd like to make a motion approve as presented.
There was a second. Did somebody second it?
I think Travis seconded.
Travis,
That was
okay,
I
see.
yes.
Okay, I see your hand now. All in favor?
Aye.
Aye.
Aye. Okay.
All 4-0 against, motion passed. Next is the KAI report.
So hopefully folks received this month's issue of Collaborating Times in their inboxes on Monday. Content for the April issue of the newsletter is due next Wednesday, March 27th. That's also the day of our next LTSS webinar, which will be featuring two presenters from University of Alaska Fairbanks. They'll be talking about their Elders Mentoring Elders Cultural Camp that's been held a couple years in a row and has proven to be a success and very popular. I think this might come up a little bit later, but I would like to remind folks that 2 LTSS webinars are reserved for U.N.I.T.E each year. So the dates of those webinars are May 22nd and July 24th. I just wanted to put that on folks' radar to start thinking about topics. You'll be receiving an LTSS newsletter later this week in your inboxes. And last but not least, the Tribal Care Facility Directory has been updated for this year. We're going through sort of the final steps on our end to get that document so that it's 508 compliant and ready for posting on cms.gov. So keep an eye out for that, probably a little bit later this spring. And I think those are my updates. Thanks.
Thanks again, Christina. Next is the LeadingAge report.
Hi, everyone. I'm going to let my colleague Janine jump in first, and then I'll follow up. And we'll be quick.
Thank you, Amanda. Good afternoon, everyone. So just a couple of quick things on the regulatory front as well as the congressional front. The federal minimum staffing rule was sent to the White House, or well, actually to OMB, the Office of Management and Budget, on March 1st, and that's for the final clearance. We do not know if there were any changes. We don't know if there was any data or analysis. We do believe that all 40,000 comments that were received when the proposed rule was released last fall. The process is that those all have to be reviewed. So we don't know if there'll be any changes to it, but it is still sitting there. It was still sitting there this morning. It could be released at any time. Just so that everyone is aware, we know that even when it does become final, and it is actually reviewed and approved and released to the final register, a lot of the parts of the proposed rule, if it's the same, have pretty long lead timelines, especially if you're between rural and urban, and between the ratio and the 24-hour RN. The only piece that is quick implementation is 60 days from final rule being released. Is the facility assessment changes to the facility assessment. And so just please know that LeadingAge is working on what we can from this standpoint before the final rule is released to help with that facility assessment piece, which would be on staffing. So that's obviously on the regulatory side. And so what we've been doing all along, even since last fall when comments were closed, we're storming the Hill and talking to representatives on both sides of the aisle in both the House and the Senate. As I think I've been on here before to talk about that there are bills in both the House and Senate. But there was a Ways and Means Committee in the House that actually passed a bill to halt the federal minimum staffing mandate. So it was the House bill that was there. It was just tweaked a bit. And so with that now, instead of becoming the Rural Access to Care Act, it's the Protecting American Seniors Act to Care Act. And that's the companion to that, to the bill that was there before. The only difference is that there was asking for an advisory committee to be put into place, and that it was stripped out of the final, through the final markup. And so what we've been doing is advocating for that, trying to get more support. It is difficult with everything that is going on in Congress, and everybody is looking for the fact of the cost on one side, obviously the workforce on the other side, but we still are trying to support that bill. And in that, we were part of a coalition letter of about 1,000 co-signers that went to Ways and Means, which was to help have safe passage of that bill. So that's really kind of what we're working on, as a whole. We don't have a full timeline, but I think it's important for everyone to know. And then the same, with CDC, the Centers for Disease Control, we are still advocating for changes to the health part of infection control and what needs to be done for COVID. There hasn't been changes for health, but we know there's been changes for the public and really the fairness of that. Other than that, we've just been trying to follow along with different survey issues and compliance, making sure things are being reported on time, following emergency preparedness, as well as we know there is a nursing home transparency rule that was effective as of January that doesn't really affect, it affects more private equity and REITs, but we're also waiting for a cultural competency rule to be released. That's also at OMB right now, and it's been there for a while. We're not sure what will come out of that rule, but it could include governance and resident rights, clinical quality standards and QAPI, staff training and discharge planning. It might be just having to have some policies and some training. We don't know about that. And then lastly, I just want to make sure that everyone's aware, we really have been making strides in Medicare Advantage since the penetration rates have increased exponentially throughout the country. And that there are payment adequacy concerns for providers that have Medicare Advantage. We know there's a lot of administrative burden, as well as the equitable access. And so we're working on both the regulatory side with CMS and CMMI, which is the Innovation Center at Centers for Medicare and Medicaid, as well as trying to work with Congress and have some draft language and different parts of bills that could be looking at that payment adequacy, as well as helplines and consumer advocacy actions. So that's everything I have. So I'm going to turn it back to Amanda.
Thank you, Janine. A lot going on. So I do want to just remind you, Janine and her team of subject matter experts, which range the entire continuum of aging services, but obviously Janine's main focus is on nursing home related activities. You can find any updates that you want. Almost daily we update our website, leadingage.org. So you can find everything that you're looking for there. Of course, you can always reach out to Janine and I as well, and we can point you in the right direction. So don't forget about that. Just a couple additional things from me. We have two big in-person events every year. One is in the spring, our Leadership Summit, and that's coming up in just a few weeks here in Washington, D.C., April 15th to 17th. I don't know if any of you are able to join, but it's an opportunity to connect with other peers in aging services with a particular focus on growing your set of leadership skills. And we welcome folks at any stage of their development in an organization, or at any part of their leadership journey. So that is coming up. We're just hoping it's a little warmer. It was 30 degrees this morning here in DC to kick off spring. So we're hoping it gets a little better. And then, of course, annual meeting, which I know many of you have been to before. I want to make sure it gets on your radar. October 27th, it kicks off in Nashville this year. And we had a great meeting in person in Chicago last year, but the registration for that will be opening on July 15th. We'll give you more information, of course, before then, but perhaps start thinking about what that plan might be. And I hope that we can have an in-person board meeting that during that time as well. And then just the last thing I want to talk about and remind people, I hope I don't sound like a broken record, but we have some great networking opportunities for folks at LeadingAge online for you to join and connect with others in aging services, not at in-person events. We have member networks, which are provider focused and agenda-driven meetings that happen once a month. The nursing home group is one that Janine and Jody leads. Jody isn't on the call today, obviously, but that is a great way to really get the updates of like what Janine was just talking about in more depth, and those meet once a month. I will post that link in the chat. And then I also wanted to remind people that in January, we launched a series of new peer groups, and they are email-based listservs. They're really an opportunity to exchange ideas and information via your inbox, essentially. And so it's 24/7. It's open to anyone, and it's really a chance to say, hey, I'm looking for a position description for a new director of nursing at my nursing home down the street. Does anyone have a great one that I can share? And then, a bunch of people will weigh in, and it's back and forth, and it's just a really easy way to connect with folks across the country. I'll also post that link in there as well. So please take advantage of those, or they're a great resource for our members to connect with one another and to really just stay abreast of what's happening. So that's about it. I'll post those links in the chat, and that's it from LeadingAge today.
Thank you, Amanda. Next, we have committee updates.
The outreach committee, we really haven't had a meeting since we left that talked about a lot of substance yet. I do think that we will probably have at least a meeting from now and between now and the next meeting that we have for U.N.I.T.E. Actually, it'd be a quarterly. So, but we have talked about, just trying to make sure that we fulfill the mission of U.N.I.T.E. while coming up with a plan for the outreach committee where we can be involved with other tribal facilities, have opportunities where they can get to know U.N.I.T.E, what we're about, and possibly be interested in joining. And then also trying to get out into some of the other tribes and other venues to where we can get our voice heard and have more exposure for U.N.I.T E. And so I'm sure in the next 3 months, we'll probably be able to have a more detailed outline as to what we've done, what we're doing, and where we're going for that committee. Dr. B, do you want to touch on the business or website?
Oh, sorry, I was muted.
It's okay.
I was jumping in there, both feet. So yes, the business meeting group has met twice since I guess our last meeting, and there's been changes to the website. We had a great meeting with Amanda from LeadingAge, and I've started implementing some of those changes. Addresses have been updated, contact us been updated, board members participating has been updated on the website. And then now we're looking for content, as Amanda had shared. We need to make some structural changes to the website because a lot of our folks visiting would be on a smartphone or on tablet. So trying to drive more video content to our website would be good, some more blogs. And then on a sidebar, I have met with Travis and Ron, but with Travis specifically looking at the TO Nation. I think, Travis, you might jump in, but they have surpassed 100 videos on your YouTube channel. Is that correct?
Correct.
So looking at how we might be able to share those in a nice component within the website, just to let other nations share and get an idea of what's going on. One great way for us to talk about our villages and campuses is to share video content. And it doesn't have to be complicated, but if you do get a chance to look at what the TO's YouTube channel, it does present really well. And I think that kind of content would generate some more activity from not only the members of U.N.I.T E, but maybe recruit some other nations that might have senior care services to join U.N.I.T E. So I think that's been really good. And then we're looking at I'm challenging everybody to work on creating a business vendor relationship. So just really looking at those vendors. If we take our top 5 or even our top 10 vendors that we buy supplies from, whether it's food, Medline for medical supplies, there's paper products, cleaning services, and give them a business membership opportunity to support U.N.I.T E, it would be another way of creating momentum and giving us some more funding to eventually support a professional organization to be developed. So that's kind of what we've been talking about on the business side. I miss anything from those that have been with me? Travis, Jared?
No, I think you covered it very well. I appreciate that.
Amanda, did we miss anything that you highlighted?
No. I think I'm really excited to hear about all those videos too. And you're absolutely right. Those are the kinds of things that really do attract people and get them interested, and a great way to teach them more about what you all have going on. So I love that you included that. Thank you.
Thank you. Next, we have old business, and Dr. B stepped off last time for a few
Oh,
minutes
yeah.
at the last meeting, so we thought maybe he'd talk about the presentation update.
Yeah, so I did talk to Julie Seward from the Southern Plains. We did not get accepted, but I was late in development. I got it in there at the last call. So I don't think, personally, I don't think we got as much of a nod or a review as we could. But the best thing is that we're in their radar from an aging organization to be able to support our seniors. And we've got a first draft at looking at presentations and then look at potential grants. That's the biggest thing for me, is if I can help in writing grants or getting some support and funding for U.N.I.T.E natives and all the good work that everybody's doing, then the better off we'll be as an organization. So I'm excited about that. I just did get 2 publications accepted in our work that I've been doing with sustainability and nutrition, which is all tribal areas have challenges for food sovereignty and social disparities of health. So I will share those out once the editors are done with those publications. So I'll get those out probably in the next 2 weeks. That's kind of my update on the Southern Plains Tribal Health Board.
Thank you, Dr. B. Any new business? Next is new business.
Probably in the new business, it's what Christina was telling us about with the LTSS webinar that we've got going on, May 22nd, July 24th. I don't know if anybody that's on this call has any thoughts, any ideas as to what a possible presentation that we could do would be. If not, then I think we need to think about it, because we have to be able to get some basic information out to Christine and her team at KAI. So at least they know the topic, they know like some presenters, and then they know the objective, so they can do a blast, an e-blast.
Yeah.
And then we're going to need to develop a PowerPoint before, not long after that. So it pushes us really tight if we wait until next meeting to do that. And so I don't know if anyone here has some thoughts, or if we want to get a couple of us together and talk about it. I think that's what it's going to take, is a small group at least to.
Yeah. I would love to challenge everybody to think of the new, on the MDS, we have the new GG section, which is really culturally or significant activities or recreational programs. And that I did just present CMS on that topic, and ended up we had like almost 1,400 people attend a virtual event. So I know you guys all do significant and unique programs within your campuses. And I think if we talk about it, it would resonate well, because people are struggling with what may be culturally significant activities for the residents. But I think if we share what we do, then that starts addressing that.
I think that would be a really good topic.
That is a good idea.
Yeah, and I've done some PowerPoint, so I can share stuff on that, and start building that out with everybody, just to kind of give some ideas. One of the things I had talked about with Travis, with the TO and the connections to their community, and that they have the news and the radio and such, and that really helps tie their elders to the greater community. I think it's a fabulous program, and you all might have something similar.
Yeah, I think that would be a great topic to speak on, and I think that whether it's us here, or whether it's the administrators that are on that reach out to, whether it's their MDS activities and kind of come up with some things that we do to address the GG changes. I think that we could put something together and present. I think that it would be very beneficial, and I think there could certainly be a lot in attendance for that.
Would you like me to head up a little committee to see if we can help get that information to Christine and Amanda for events?
I think that would be good. So Dr. B, I'm guessing you would be willing to be on that.
I would be willing, yes.
Okay. Is there anyone else that is on that would be willing to be on that committee as well?
I'd like to attend the committee as well.
Okay.
I'm in, please.
We have 3. We're good.
Yep, I think that would be good. What we could do is at least let Ina know, because I would like to give her the opportunity if she wanted to be on, or anybody else that missed, but I think her in particular to see. So I think that would be good, though. I think 3 on this committee would be awesome. And then maybe we would have something to bring back in our April board meeting.
Yeah, and so what's the timeline that we need? Is there some parameters? I need to get it up on my whiteboard so I don't miss it.
Okay, so I think it's May 22nd is when the LTSS webinar would be. Christina, when do we typically want to have the objectives and the topic, the title put together? So you normally want that kind of early in May, right?
Yeah, because I'm looking at the calendar now. So we usually send out a few e-blasts. So if we could have everything in hand by, let's say, May 1st, that would be good.
Yeah. Okay. That sounds great. So we'll back it up for maybe the April 22nd if we can, as a group, have something done. I'm also wondering, Travis, what's a topic that you're presenting, or the TOs presenting at LeadingAge Arizona?
So it's connecting communities, and Dr. B, I shared it with you, and if you think it's appropriate, I can share it out with everyone else. And then we've also submitted to LeadingAge National, so that if so we're going to present we've already been selected and presenting at LeadingAge Arizona. It'll be myself, Isidro Lopez, my community liaison, and then William Oliveris, my IT manager, so we'll touch on all 3 aspects of our roles, and then also provide some instruction on how we're accomplishing it, and the type of content, and just hit on those 3 different domains in our presentation. But I'll be more than happy to share what I have, and I'll be more than happy to participate in whatever capacity is appropriate for this work as well.
I'm a big believer in not reinventing the wheel and sharing all the good works that are out there. So I think it'd be worthwhile to share.
Excellent. I'll share it out with the group after this meeting.
Okay, well, that sounds like a plan. Anything else, or are we ready to adjourn?
I can't think of anything, Tiffany.
Okay.
I
move
that we adjourn.
Okay, adjourn at 1:35 Mountain Time. All in favor?
Aye.
All right.
I'm sorry, I forgot the second. Sorry.
I'll second it.
Yeah. Thank you. I told him in the last meeting I'm learning, so. Thank you very much, everybody.
Thank you.
Thank you. Thanks, everyone.
Have a great weekend.
Bye, everyone.
You too.
Bye.
Bye.
See you next time.